My oncologist paused the treatment for a dental visit. You know that feeling? Your phone buzzes with a message from your oncologist. You open the patient portal, and there it is. Your next cancer treatment was on hold. Your heart does a little dip, and you read the reason pending dental clearance. A trip to the dentist, really, with everything else going on, this feels like the last thing you need, a random, frustrating roadblock. When all you want to do is continue to fight. You're probably thinking, why on earth my dentist suddenly in charge of my cancer care? If this is you, I get it. But the question is the right one to ask. And the answer is resounding yes. This visit, that's important, in fact. Getting your dentist sign off is one of the most critical proactive things you can do to make your treatment safer. Today, we're going to break down exactly why your oncologist hit pause, what are the dental team looking for, and how this one appointment helps you protect you from serious preventable problems down the road. Now, the medication and the mission. First, let's talk about the powerhouse medication your oncologist has prescribed. You're likely been told you'll be starting on a bone-targeted therapy, probably a drug like denosumab or zoledronic acid. When cancer involves the bone, these are our best tools. Their job is to keep your bones as strong as possible, reduce pain, and prevent fractures. Think of your bones like a city that's constantly being rebuilt. One crew is responsible for carefully demolishing old weak structures. This is bone breakdown. And another crew follows right behind to build new, stronger ones. These medications are like a new foreman who shows up and tells the demolition crew to take an extended, indefinite break. The building continues, but the breakdown stops. This makes the whole structure, which is your skeleton, stronger and more resilient. Whether it's denosumab given in a simple shot or zoledronic acid delivered through an IV, their mission is the same. They do a fantastic job, but like any powerful therapy, they have potential side effects. One of them is rare but serious, and it's very reason your dentist becomes the VIP on your cancer care. The why. Let's talk about MRONJ. The whole reason for this mandatory dental visit can be summed up in one clunky acronym, MRONJ, which stands for Medication-Related Osteonecrosis of the Jaw. That sounds terrifying, so let's use an oncology. Osteo, which means bone, necrosis, which means death. So MRONJ is a rare condition where a part of your jawbone struggles to heal, leaving it exposed. So why the jaw? Imagine your jawbone is a busy city street, different from the big highways which is spine or legs. It has a unique traffic patterns and consistently in use. The medication that protect your skeleton are great for the highways, but for the specific street, they tell the road repair crew to stop working. Now imagine something that creates pothole on the street, like having a tooth pulled, gum surgery, or even a deep infection. Normally, the road crew would there be in a flash to patch it and good as new. But because the crews are forced on a breakdown by our medication, the pothole just sit there, gets deeper and becomes bigger, leading to pain, infection. That open pothole is the MRONJ. Now, it's really important to hear this. The condition is uncommon, but because it can be a huge pain, literally seriously impact for quality of life, we take better safe than sorry approach in this condition. And this prevention starts at the dentist chair. Timing is everything. Why it has to be before treatment. Okay, so why pause everything? Why not just deal with it later? It all comes down to your healing. Your body's natural ability to repair itself, the expert road crew that we talked about, is at its peak before these medications are in your system. Think of it like this. You wouldn't set sail on a long voyage without first checking the ship for leaks in the hull. Your dental clearance is the pre-voyage inspection. If you have a failing root canal, a cracked tooth, or a serious gum disease, those are like small cracks in the pavement just waiting to become massive potholes. Having a tooth pulled is the single biggest trigger for MRNJ. It's far better to find out and fix those potential potholes before the road crew goes on a medically ordered break. This gives your jaw the time and space it needs to heal perfectly. Finding out you need a major road work after you've started the medication creates a much trickier situation. Healing is slower and the risk of MRNJ goes up, and it can force a pause in your cancer treatment, the very thing you're trying to avoid. So this isn't a delay. It's a smart strategic move to ensure your cancer treatment and continue without interruption. What do you expect in dental clearance visit? Knowing what's coming always makes things less stressful. This visit is basically a fact-finding mission for your dental team. Here's the game plan. First, you will talk. You're the star witness here. You need to know your schedule for drugs like denosumab or zoledronic acid for your cancer treatments, and your oncologist plan for it as well. Clear communication between you and your dentist and your oncology team is everything. Next, the exam. We're going to take a careful look at everything: your teeth, your gums, your tongue, and your cheeks. When you're in search for any potential troublemakers like deep cavities that could need a root canal or extractions, advanced gum disease, which is basically a chronic infection, broken or hopelessly damaged teeth, poorly fitting dentures that could be causing sores. And finally, yes, they're going to take x-rays. They give us the full story, letting us see things the eye can't see, like hidden infections at the tips of tooth roots or bone loss hitting below gums. Based on all that, we'll map out the plan. The goal is simple: get your mouth as healthy and stable as possible before you start that first dose. That might mean a few fillings, a deep cleaning, or if a tooth just can't be saved, taking it out. We're going to get your mouth ready for the journey ahead. You're the MVP of healthcare team. Your role in all of this absolutely crucial. When it comes to your health, you're not a passenger, you're the pilot. Being proactive about your oral health is a superpower during cancer treatments. First, double down on your home care. This is your first line of defense. Brush gently twice a day with a soft bristled brusher. And fluoride toothpaste. Don't forget to floss. A clean mouth is a healthy mouth with fewer bacteria to cause troubles. Second, be our eyes and ears. Once treatment starts, pay attention if something in your mouth feels off. Don't brush it off. Call your dentist and your oncology team right away. Be on the lookout for any new pain, swelling, or a feeling of numbness in your jaw, or teeth that suddenly feel loose, sores that don't seem to be healing, or any visible bone poking through the gums. Catching an issue early is key. It lets us jump in and manage it before it becomes a bigger deal. Remember, your oncology team and your dental team are working together, and you are the link that puts all it all together. Let's go back to that moment of frustration. The message from your oncologist wasn't a roadblock. It was a green light for critical safety check. This dental visit isn't a detour, it's a vital pit stop that brings your whole care team together to protect you from every angle. So here's the call to action. Keep asking questions, talk to your doctors, and when you head to the dental appointment, know that you're doing something incredibly powerful. You're taking control, preventing a preventable problem, and clearing the path so you can focus on your cancer treatment with more confidence and one less thing to worry about. You're an active, essential partner in your own care, and that's a pretty amazing thing to be. Always keep asking, and see you again in a new episode of Cancer Answer.